Jada Love Health Assessment Video. Hello, I'll be doing your head to toe assessment today. I'm going to start with your head, okay? Just going to feel. It's normal cephalic without masses. It's atraumatic. Your scalp is intact. There are no lesions, no sores. Your hair is of normal color. It's evenly distributed. The texture is normal for your race. Okay. And now I'm looking at your face. Your face is symmetrical. Your nose is midline. Your lips are midline. Your eyes are set a normal width apart. Okay. We're going to start with doing an assessment of your eyes. If I wanted to test your vision, we would use a Snellen chart, which you would stand 20 feet from the chart and read the smallest line that you could see from that distance. And ideally, the line would be line 20, which would mean you would have 20/20 vision or perfect vision. Okay? So that would take care of your visual acuity. But I'm looking at your eyebrows and your eyelashes. They're distributed equally. Your sclera is pink. Hold your head back just a tad for me. Your conjunctiva are white. Your lacrimal ducts are not clogged. They're open, but there's no drainage present. Okay. Now, I'm going to wiggle my fingers from behind you one at a time, and I want you to tell me when you can see my fingers and what number you see. Okay?
3.
Very good.
3.
All right. Now I want you to look at my finger and follow it. All right, I'm just checking your cardinal fields of gaze. Okay, and now look at it. Follow my finger. Very good. I'm checking you for accommodation, which is present and normal. All right. Now we're going to do the cover-uncover test. I want you to pick a spot on the wall. Let's go for that one right there. And I want you to cover each eye, one at a time. Alright, there's no strabismus or nystagmus noted with the cover-uncover test. Very good. And now I'm going to test your pupillary response. Pick a spot on the wall for me. Pupils are equal, round, and reactive to light. They go from 4 millimeters to 2 millimeters and constrict properly. There is direct constriction with consensual constriction. Direct, consensual. Alright, continue to look at that spot. It's going to shine this light right here. And the corneal light reflex is present. Okay. Now I'm just going to palpate your sinuses, and I want you to tell me if you feel any tenderness. Frontal sinuses, maxillary sinuses. Any tenderness?
No tenderness.
All right. And now I'm going to test another cranial nerve, and I want you to yawn for me. All right. TMJ, there's no cracking or popping noted. All right. And now we're going to go to your ears. Okay. For testing purposes, we're going to do one ear only. Your pinna is of normal shape and size. Is there any tenderness?
No.
Okay. Just going to move this back a little bit. I'm just going to take a look in your inner ear. And let me pull up and back to visualize the inner ear. You can see your ear canal. It's clean. There's no wax. It's not pink. I'm visualizing your tympanic membrane. It is pearly gray, and I can see your cone of light. Okay? Now we're going to test your hearing. I want you to close that ear off for me and let me know what word I whisper.
99.
Very good. And now we're going to do some conductivity testing, okay?
I can hear the sound in both of my ears.
Very good. That's what we're looking for. Alrighty. That was the Weber test, and now we're going to do the Rhine test. Uh-oh. Can you hear that?
I can hear it.
Let me know when it stops.
It stops.
Can you hear it now?
Yeah. I'll let you know.
Let me know when it stops.
It stops.
Very good. Air conductivity is greater than bone conductivity, which is normal. Alright. Now I'm going to test your sensation on your skin, on your face, okay? What we're going to do, I want you to close your eyes and tell me if you feel something sharp or dull.
Dull. Sharp.
Okay, keep your eyes closed. Do you feel me touching you?
Yes. Right jaw. Left jaw.
Good.
Both jaws.
Does it feel equal?
Yes.
Alright, very good. Now I want you to wrinkle your eyebrows for me. Good. We're testing the cranial nerves that control your facial muscles. Good. Smile big. Pretty smile. Puff out your cheeks for me. Alright, very, very good. Now I'm going to look at your nose. Your nose is midline. It's placed appropriately in your face. It's shaped normal. It's symmetric. Okay, we're going to test the patency of your nose. I want you to cover one nostril and take a deep breath. Very good. The right nair is patent. In normal circumstances, we would test both, but for this assessment, we're only testing one. Alright. Now, I have something I want you to smell. I want you to close your eyes and cover that nostril and let me know what you smell.
Cinnamon.
Very good. That's testing your olfactory cranial nerve. Alright. Now, I want you to hold your nose up like you're a pig. Not the best example, I guess. And there you go. And I'm just going to look inside. I see your cilia. Your nasal mucosa is moist. Your turbinates are visualized and they are of normal color. There's no drainage, no exudate, and they're not pink or red. Okay. Now, I'm going to look at your mouth, and if you can just relax your lips for me. I'm looking at your outer lips. They're moist. They're normal size and shape. They're symmetrical. And I want you to smile big for me, Clinch. Okay, and I'm just going to take this tongue depressor and look at your lower lips. The inside of them, I'm sorry. They're pink and moist. There's no cracking. Okay. Now, I want you to open your mouth. I'm going to use this light. You can just relax and just keep it open. I'm looking at your cheeks, your buccal cavity. It's moist and pink. There are no lesions. Very good. Alright, you can take a break. Now open up and hold your head back for me a little bit. Okay, and say ah.
Ah.
The uvula rises. I can see your tonsils. They're grade 2. There's no redness, no exudate. Okay, one more time. Just open up. Alright, I can see your hard and soft palate, and I could really see your soft palate when you said ah for me. It seems like you gagged a little bit also, which lets me know that you're cranial nerve 10 is intact. Okay, lift your tongue. The floor of the mouth is pink and moist. There are no lesions. And I can see your lingual frenulum. It's intact in midline. Stick your tongue out for me. The tongue is of normal shape and size. Move it side to side. We're testing cranial nerves 9 and 10 now. Very good. Alright. Now we're going to do some resistance testing with your neck. Okay? So I'm going to put my hand here and I want you to push against my hand and hold it. Good. This side, push and hold it. Very good. Alright. Let's look at the range of motion of your neck. Chin down. Chin back. Good. Side to side. Good. Ear to shoulder. And ear to shoulder. Alright. Very good. Now I want you to shrug your shoulders for me. Okay, relax. And push up. Very, very good. Alright, it's important to note that we've just tested cranial nerves 1 through 12 and they are grossly intact. Now I'm just inspecting your neck. Your trachea looks midline. Alright. And I want you to turn this way for me. Now I'm just palpating your trachea and your thyroid. I don't feel any masses. Is there any tenderness?
No.
Trachea is midline. Alright, hold your head down just slightly for me. Just a little bit. You can hold it. There you go. Good. Alright, I want you to swallow. Good. I can feel the isthmus of your thyroid. Very good. Alrighty. You can just stay right there for me. I need to check your lymph nodes. Okay. Preauricular. Postauricular. Occipital. Submental. Submandibular. Cervical. Superficial cervical. Deep cervical. Posterior cervical. And supraclavicular. Any tenderness?
No.
All lymph nodes are felt and they are palpable. And we're going to take a break so I can let you get changed, okay?